Welcome to Fun with ECGs. "30 seconds to interpret this ECG for ischemia." I particularly want you to consider leads V1, 2 and 3. And how can they look like this in comparison to V4, V5, V6? So baseline parameters: heart rate 87, sinus rhythm, normal axis, normal QRS. We have inferior ST elevation in lead 2, 3 and AVF, and we can measure that at around 3 millimeters. We have this very odd ST elevation in V1, which doesn't make sense anatomically when you have ST elevation in the inferior leads. That wouldn't be the normal run of the right coronary artery, and it's very hard to see how the LAD could be causing this. Now, actually, V1, V2, V3 look like posterior leads. Posterior leads, if you simply carry on around the back of the chest from V6 and call them V7, V8, V9. These can be useful in looking for a posterior myocardial infarction, and it's excellent this ambulance crew have done this in considering this inferior STEMI to see if it's extending elsewhere. They should have been called V7, V8, V9 on the ECG and crossed out the V1, otherwise it leads to confusion, and there's nothing on this ECG otherwise to tell you that this is what they've done. We can also see that there is some loss of R wave, although we don't know how much R wave was there to start off with, but small Q waves are forming, showing signs that damage is happening, although this could be stunning rather than infarcted tissue, so this could recover with urgent treatment. And we can see extensive ST depression in V4. We obviously can't see V1, 2, 3, but this suggests extensive amount of ischemia going on together with the ST elevation in the infraposterior regions. So this is an acute infraposterior myocardial infarction. The patient needs an emergency STEMI protocol to be instituted and go for urgent primary percutaneous coronary intervention. Thanks for watching.